Alright, this is going to be the nose, sinuses, mouth, and oral pharynx exam. The first thing I'm going to do is examine the nose externally for symmetry and deformity. It looks like his right nostril might be a little higher. Did you ever break your nose or anything? No. Other than that, looks symmetrical. Nasal. So now I'm going to be looking in the patient's nose, looking at the mucosa, the turbinates, making sure everything looks uninflamed or anything like that. So I'm just going to look in your nose quick. Yep, the turbinates don't look inflamed. Looks a little red. Nothing to worry about. Now I'm going to look at the other nose. This position is really weird. Yep, everything looks good. Turbinates look clean. A little red in there too. Do you have a slight cold or anything? No. Alright. And then I'm going to look at the lips, noting for any color or lumps or anything. Lips look clean. Then I'm going to look at the dorsum of the tongue. Can I just have you stick your tongue out? Yep. No leukoplakia or plaque or anything on the tongue. Then I'm going to look at the cheek. Can I have you open up your mouth and just bring... Okay, looks good on that side. Yeah, looks good on that side. No ulcers or anything like that. Then I'm going to inspect the gums for color and swelling. Good, good. I'm just going to look at this bottom one here. Good. Yep, no swelling. No gingivitis. Then I'm going to look at his teeth. Can I just... Yep. Pearly whites. Doesn't look like he has smoking teeth or anything like that. Then I'm going to have you lift your tongue up. Good. No, back. Yep, the frenulum looks good enough, good length. Also, his saliva didn't look like he had dry mouth or excess saliva. Then I'm going to be looking at the floor of your mouth. Can I have you open up your mouth and stick your tongue up like that? And here, there we go. So I'm just looking at the salivary glands, the openings for them, and they look good there. And then I'm going to be looking at the pharynx. So can you open up your mouth and stick out your tongue and say ah? Good. The tonsils looked good, and it rises with the then I'm gonna have you block one nostril and breathe in, and then do it with the other. His left nostril seems a little occluded. Now I'm just going to be looking at your sinuses. I'm going to be looking at the maxillary and the frontal, and then I'm going to be palpating, or tapping, I mean. Was there any pain with that?
No.
Okay. And then I'm also going to be looking at cranial nerve 12 for or actually I already looked at that. The patient was able to protrude his tongue. And then I'm also going to be looking at cranial nerve 9 and 10, which is the gag reflex. So I'm just going to have you open up your mouth and stick your tongue out. And I'm just going to slightly palpate the back of your mouth. And I'm just going to be looking I'm just going to be looking for the gag reflex. Good. And then the patient does not have halitosis, which is bad breath.